Wanna talk? So let's talk. Yeah. Talk. You wanna talk? You gotta talk, you need to talk. News talk.
I talk, you talk to Solomon. I talk, you talk to Solomon. Yeah, let's talk to Solomon. Talk to Solomon.
You gotta talk, you wanna talk.
Good evening and welcome. It's time for Talk to Solomon. Thank you so much for joining us. Our phone number is 866-808-0637. If you would like to call in, my name is Stan Solomon. I'm the host and the co-host.
Chief Steve.
Former Police Chief Steve Davis, lawman extraordinaire. We're going to start this evening with a doctor. His name is Dr. Van Camp. Dr. Van Camp. His first name is Kipp. And Kipp, how are you?
Great. How are you doing?
Fine. Glad to have you with us. I'm going to ask you just to explain to our audience a little bit about yourself.
Okay. I was a family physician for several years. Went back and did a radiology residency. So I have two different residency training certifications, and then I did a interventional fellowship in radiology, and that's the guys who use imaging guidance to do procedures. So we're a surgical specialty. And what else about myself? I am an author. I've written two books. And what's going to happen? It says I'm having trouble. Can you guys hear me?
Yeah, we can hear you. Keep going.
Okay. Sorry, I'm being distracted by the internet. Anyway, I sat down and wrote a book. I've written two books. My first book was about a pet. I am the son of a veterinarian, and so my wife and I had a pet that was a first daughter, and so we decided to, when she died, I said I want to memorialize this pet, so I sat down and wrote a book about a pet. Well, book was fairly well received, and so when Obama's plan was passed, I said, well, why not write a book in a new genre, healthcare? And I felt the reason I was qualified is I had been a primary care specialist and then a subspecialist, and felt that I had the qualifications to speak out on the Obama plan from a medical standpoint, because I didn't hear many doctors speaking out. And so I sat down and wrote the book. I did my research. In the book, I explain what's wrong with our current system, what do we do well, what can we do better, and then I look at the Obama plan and say, is it really the solution? And from what I can deduce and from my research, I do not believe it's the solution. So.
All right, let me ask Chief to ask the next question, because I have several.
Well, first of all, what kind of pet did you write the book about?
I had a Bichon Frise. My wife and I, when we first got married, I was spending so much time at the hospital as an intern and then as a resident that I wasn't home much. We didn't have any kids yet. And so I wanted a dog that my wife would like, and so I bought her a Bichon Frise. Well, the dog lived to be 17 years old, and when she died, it was such an absence in our life. It left such a void that I said that can't be the end of that. And so I sat down and wrote this book to memorialize her, and it was kind of a love letter to my wife, and but I found a theme that people could relate to, and I said, how do pets affect our lives from a medical standpoint? So I put in some science behind a story about our dog.
Well, that's great. And also I'd encourage you to read the story about St. Roch, the patron saint of dogs and dog lovers. And also there's a lot of biblical references about pets and animals, and they will join us in heaven someday, which should be very comforting to you.
Yeah, that is comforting to hear you say that. So I'd love to see Allie again. She was quite a little dog. It's amazing how it touch our lives. So.
I agree with you that animals play a special place in people's lives. We have always had pets. We have two shepherds now, and they're just part of our family. And when one of them gets sick, my wife goes berserk in fear that something might happen to one of them, as we've had dogs pass in the past. All right, well, let's go on to Obamacare, because Obama could care less. And his bill, which has absolutely nothing to do with health care, is a perfect example. Now, let's start with the most ominous reality, and that is any socialized medical system, as exists anywhere on the face of the earth today, is going to be a limited system, and by necessity, and more necessity, it will preclude certain groups from getting the care they might otherwise afford, or otherwise want, or otherwise need, or otherwise expect, because you're going to compete one against another. It's no longer a system of insurance, but it is a co-op where the greater good, the greatest good, the most efficiency, and all those things are in fact an integral part of it. Am I close or am I off?
No, I think you're absolutely close. If you look at the European models, if you look at Cuba, if you look at any of our socialized systems in the world, the lesser of our brethren are some of the first patients who don't get the care that they need. I'll tell you, Obama laid his cards on the table when he said that if grandma needs a pacemaker, or if mom needs a pacemaker, we'll give her a medication instead because it'll be more cost effective. And so that's known as rationing of care. Unfortunately, the media didn't want to run with that and make sure everybody understood that that's what rationed care is, but that's exactly what it is. When a bureaucrat decides what type of medical care a patient needs instead of the doctor deciding that, and the reason they decided is simply for cost, then we have a problem. And Americans don't like that.
Well, Americans aren't used to it. I mean, you can get used to anything. We had a bunch of people go to concentration camps, and they became able to survive in those camps, but it's not good, it's not right, it's not moral, and it's certainly not a benefit to anyone other than bureaucracy, who is given a lifetime employment guarantee by such a system.
If you talk to almost any doctor, certainly any doctor that I work with or know, and you ask them what their focus is, the doctors who say that their focus is to take care of patients are the doctors that are doing a good job for their clients or for their patients. The doctors who say, if they're honest to you, and say our focus is the mighty dollar, the almighty dollar, then those doctors have a chance that they won't do as good a job for their patient because their focus is no longer on delivering health care. And most doctors I know, when asked that question, say, you know, I don't even want to deal with the price. I don't want to deal with the cost. I want to take care of the patient. That's my job. That's what I do. I'll let the front office or the billing office or whoever take care of the cost. And so that's probably where you want our doctors. That's probably where we want to be, is in the trenches taking care of patients and letting everything else take care of itself. The problem with that whole philosophy is, here we are, doctors have not engaged in the discussion because they are in the trenches and they do have their blinders on and they're busy taking care of patients. And they keep hoping that this is all going to work out. And so I'm jaded, cynical enough, I guess, that I said, it's not working out, I'm going to speak up. And I'm just one lone voice, but oh well, that's at least one more doctor speaking out.
I think that's wonderful. Now, joining us is my friend Brent Johnson from freedomradio.us. Brent, how are you this evening?
Doing just fine, Stan. Glad to be with you as always. I'm listening to this really interesting conversation about Obamacare and its ramifications. And
do you have a question for Dr. Van Camp?
Well, actually, it's just my comment. I think what he's saying, what the doctor is saying is very right on. My comment is that essentially, if you give any government the authority to determine what is best in the way of health care for anyone at all, the standards by which a government bureaucracy operates are very different than the standards by which a medical or other healthcare professional operates or a patient operates. And it's all about the standards that determine the priority. What's most important to a government is not the same as what's most important to the patient or to the person who's trying to make the patient well.
Well said. Now, Dr. Van Camp, what is the name of your book?
The name of my book is Misdiagnosis, and of course it has a tagline underneath. It's a practicing physician's case study in health reform.
Well, using the term health reform, I guess in the pejorative view is correct. The reality is it is to not give health care reform, would be a more true description. Would you agree?
Yeah, let me go through just a couple points in the book that answers that question or responds to what you just said. One of the things that the plan does or proposes is to take those uninsured. You know, we could have a long debate over who the uninsured are in this country and why they're uninsured, but we'll say that for another time. But okay, so we know there are a significant number of people who do not have health insurance for various reasons. One of the answers in Obamacare is to expand Medicaid. Have you ever heard of a patient saying, "Don't touch my Medicaid. That's the best insurance I've got, and I love that Medicaid"? Now, I'm not saying Medicaid doesn't have its purpose, but I am saying, is that really a solution? Or asking the question, is that really a solution? Let's expand the roles of Medicaid to solve our uninsurance problem or our lack of insurance problem. I don't think it is. And so that's just one that kind of paints your statement about, you know, whenever a government takes control of something like healthcare, the focus changes. It's no longer on the patient. It's more on the cost, or it's more on the bureaucracy and what's best for the community instead of what's best for the individual. And that's a bad place to be, because now you're making decisions, again, based on cost. It's almost that, what are those humanism exercises people do? If you have a sinking boat and there's 10 people in the boat, but you only have rations for 9 people, who are you going to throw overboard? That kind of a thing. It's almost that same idea with Obamacare.
By the way, the answer is always Obamacare. That's what you want to throw overboard. Then there'll be enough for 12 people.
Yeah,
and I want to go there, and I'll start with you, Chief. You were in law enforcement for many decades. Law enforcement serves a purpose very much like healthcare. It's to provide a service for people who need it, a community and for individuals. You had to fight the battle of limited budget and existing assets, whatever, human and other assets, and had to see how you could best make that work to serve the people. The reality is the best model for protecting people is for people to protect themselves, right or wrong.
You're right on target there, and saying that it's a known fact that police departments can't protect everybody all of the time. And the Supreme Court, when they used to have decent rulings, actually ruled that that was the case, that people should not expect the police to protect them all the time because they just can't do it. So you do have to protect yourself. So with the healthcare issue, you're right. People need to take this, take the responsibility themselves to have their own healthcare and take care of their own health. I think the biggest issue, though, that people don't talk about very much is the fact that if you don't have health insurance for one day and something catastrophic happens, you're going to be bankrupt, you and your family. I think that's the biggest issue in this whole monetary part of this that people need to address that's not been addressed yet. So people need to be able to have health care available, and in this country have the best health care that you could get, and then the means to be able to pay for that, which means get some jobs there, Obama. And then, but if for one moment, if you transfer from one insurance policy to another and have one lapse of 1 hour and something catastrophic happens, you could be bankrupt, and that's what I think people are afraid of. If we could address that and fix that, that'd be a big part of this equation that would be solved.
Well, there's an obvious answer. It was put forward by Pat Rooney, the former president, he's now passed away, of Golden Rule Insurance. They were called the Section 125 plans or medical savings plans, and that is people should be made available to anyone, everyone, and all people to have major deductible catastrophic coverage. So you have $10,000 deductible. That means the cost is very small, relatively speaking. That should be made available nationwide to everyone because the cost would be, you know, $15 a month or some modest sum like that, because the chances of needing it are remote. Yes, there's one in 100,000 that hasn't happened, but 999,000 out of 999,001, it doesn't happen. Brett, your thoughts?
Yeah, well, and I have what would probably be called an unpopular view on this. I do not think the government has any business at all. Not Medicare, not Medicaid, none of it. Absolutely none. Don't touch my Medicare, don't touch my Medicaid, excuse me. In the first place, the idea that you have to watch out in case you have a catastrophic illness is based on the principle of living in fear. You know, a meteor might hit my house, so should I be completely paranoid and devote all of my resources towards protecting myself in case a meteor hits my house? Or do I go through life knowing that there's a possibility that the meteor might hit my house and I might lose everything? Well, catastrophic illness capitalizes on that fear. The idea that, you know, something could happen and you could end up having a catastrophic illness. I say that, look, if you want insurance, get it through the private sector. Blue Cross Blue Shield. I think your idea of having a $10,000 deductible minimal cost is wonderful. But get the government completely out of it. The government's role is not to take care of your health, not to protect you from catastrophic illness. And by the way, I don't carry any health insurance out of choice. If I get a catastrophic illness, guess what? I might die. That's part of the risk of being alive.
Well said, Brent. By the way, I must admit here on this national program with over 1 million people who watch it, I didn't have health insurance for 25 years. And then I passed a certain age and they gave it to me for free. Well, thank you. I don't care. I've never been to a doctor before. I won't go to a doctor now. Never took any drugs before. Won't take any drugs now. Never took an aspirin before. Won't take an aspirin now. So whatever. Knock yourself out, government. I'm with Brent. Doctor?
Well, I tend to agree with what Brent has said. I think anytime the government gets in the middle of things, they just expand the bureaucracy and it costs more. There's no question when Medicare started in 1965, it was only a pittance of what it is today. And so it's grown into this bloated bureaucracy that isn't funded. It's going to be bankrupt very soon if it's not, if we don't change our ways. And so the government is never the solution. I'll give you a couple very simple things that are on the same lines. Transparency is missing in medicine. If you have 3 people laying in a ICU bed and all 3 of them are the same gender and same age and they all have had a stroke, but one of them has Medicaid, one of them has Medicare, and one of them has private insurance, all 3 of them will have a different bill. All 3 of them will be charged a different amount. And that's a good example of no transparency. How is that even legal? If you had 3 different fast food restaurants and they didn't charge something comparable for each of the same services, at least 1 or maybe 2 or maybe all 3 of them would go out of business. And that's free market. And then in the same lines of free market, when the government steps out, price actually comes down. For example, take a plastic surgery, and I'm going to use one that's common and gets some attention in the media, and that is breast augmentation surgery. Breast augmentation surgery, the price has actually come down over the last 15 years in this country. Why is that? Because the insurance companies won't pay for this. It's an elective procedure. So elective procedures actually come out of patients' pockets, and the price actually comes down because competition works and the free market works. Whereas all the other prices around the country in healthcare have been escalating. And that's not because it's all going to doctors' salaries. Do you know that less than 10% of Medicare, of the entire budget of Medicare, less than 10% goes to physician salaries? And so another trick that's done is to try and pit patients and citizens against doctors by saying doctors are rich, fat cat citizens, and we should all be envious of that. The problem with that is that well, there's a whole discussion about that, but the class envy warfare is one of the tricks. In fact, I just saw an article in Forbes just released yesterday that said that the top 5 professions or the top 5 money earners in America are not the CEOs. They're all doctors, every one of the top 5. Of course, they excluded professional athletes and they excluded attorneys and they excluded the Hollywood types. So doctors do make a good living, but when you figure out how many hours we work per week, the New England Journal of Medicine did a study recently, or in the last couple of years, and it showed that doctors there are only 3 specialties that make over $100 an hour, and it's plastic surgery, orthopedic surgery, and cardiology. The average for primary care is between $35 and $40 an hour. So doctors aren't out there, if we're getting rich, it's not because we aren't working hard or spending a lot of time in it. Also, one more point on that same thing. I'm 49. When I turned 45, I paid off my final student loan. So it took me a long time to get out of debt or to get my student loans paid for. So there is a long commitment, and there's delayed gratification. But that's exactly why doctors shouldn't be worried about the monetary side. We should be practicing medicine.
Chief?
Well, let me, unlike the host, Stan Solomon, I've been to the doctor a lot. Let me tell you, I don't want my doctor stressed out. I don't want him worried about his mortgage or worried about taking his wife out for dinner or worried about going on vacation. I want my doctor happy and rested when I go in to see him. So I'm fine with him making a lot of money. I think the issue here, though, is we've talked a lot about the free market. But with insurance companies today, there is no free market. You must go to the doctor that they say you go to and pay the money they say to pay. I can't shop for a doctor. I can't shop for medicine because my insurance policy that I have doesn't allow that. So there has to be some kind of mechanism. I don't want the government to do it, but somebody's got to do it.
Well, I couldn't agree with you more. The free market is the answer. Brent is 100% correct. But let me mention this to you folks. Now listen to this carefully. The cost of medicine has escalated at 3 times the rate in what government's involved with there were governments not involved. That's simply fact. Secondly, that you mentioned, Dr. Van Camp, that less than 10% of the money from Medicare or Medicaid or both goes to doctors' salaries or doctors' payment. The reality is, ready, folks? Half of what is spent of the budget for Medicare, Medicaid, government involved in anything, goes to the bureaucracy. And people don't understand that government is about paying for government, and anyone else that gets a benefit is incidental. They say that government consumes 80% of all the money that runs through government, and I think it's more than that. I think that government is the, how should we say this? It is the albatross around the neck, around the ship of everyone's life. And that if you get government out of the picture, yes, there'll be some people that might not get something, although we have a Judeo-Christian ethic in this country, thank God, that we take care of folks that need help. All you have to do is look at that lady that got bullied on the bus and people contributed $500,000. She doesn't have to sit on the bus for $6 an hour and be bullied by a bunch of punk kids. At least understand that anytime government's involved, if they take $1 from Dr. Van Camp or from Brent Johnson or from Stan Solomon or from Chief Davis, that they're going to keep 80 cents of it and sprinkle 20 cents around to a few of us to say they did something. Doctor?
Oh, I absolutely agree. That's why the free market works. If you had the chance to go from one doctor to the next and say, this is what I need, or better yet, if you went to private insurance and you said, I need a insurance policy that fits my needs, so for example, if my wife and I are past the age of having any more children, and so we don't need a maternity plan, we don't need pediatric vaccination plan. Why shouldn't we be able to go to our insurance company and actually pick a plan or design a plan that's patterned for my needs rather than a pattern that fits all comers? And the reason the insurance companies do that is because they're forced to be regulated to require all of these different services. And if the government would loosen those restrictions, the free market would work in the insurance industry as well.
Brent?
Yeah, I have several comments. First off, what Chief Steve said a moment ago, it's not that you can't choose your doctor. It's that you are faced with a choice. Either take the conditions of having that insurance or choose your doctor. In other words, you can choose your doctor, but you have to give up your insurance in order to get that choice. And once you realize it, then you sit there with choices, you make your choices, and you have to accept the consequences. Comment for Dr. Van Camp, never apologize for making money. You know, I sit there, I see you almost apologizing for doctors who are making money. You know, the whole idea of America is if you work hard, you get to keep what you earn. That's the theory behind it. So somebody's making money, that's not a bad thing. And we've got a society which has completely forgotten the 10th commandment, thou shalt not covet. You don't sit there and you say, well, they're making money and I'm not, and therefore there's something wrong with them. No. You want to make money, go and work real hard and use your brain, stop depending upon the government for a free handout, and earn your living. Ronald Reagan said that government is not the solution. Government is the problem. And I think that's kind of what you were saying. And my final comment here was that the free market is absolutely the answer. And Dr. Van Camp said it very well with the breast augmentation surgery. The price has gone down because it is a free market. Because if the insurance companies aren't paying for it, and if the prices are so high that neither you nor I can afford them, then nobody's going to buy those services. And guess what happens? Suddenly, the price goes down. I did a story a while back on how much the markup was from pharmaceutical corporations on the pills that they produce. And it's unbelievable. I mean, it literally is in the 10,000%, 100,000% on some of these pills. So there's a lot of room for them to lower the cost of all kinds of factors that go into medical and health care. And they will do it if the insurance companies are not paying for everything. And final comment, everybody goes to you get a sniffle, you go to the doctor. Why? Because you're not paying for it. When you have to pay for it, you will sit there and you'll take care of yourself until you have to go to the doctor. Stan Solomon is a perfect example of what I'm saying.
Well, thank you. Perfect and Stan Solomon have been mentioned a couple of times, but there was a word asshole there in someplace. Doctor, again, the name of your book.
Name is Misdiagnosis, and it's a practical, concise, straight talk type of look at Obamacare. It's, I put my heart and soul into that book, just like I did in the first book, and I really wanted people to come away from that book and say, okay, I really have a pretty good idea what's in this Obama plan, and I think there's actually some solutions out there that are better, so I address the solutions as well.
Wonderful. Now, I did not get a copy of your book before the show, but I would ask you please make sure you get one to me so that I have an opportunity to read it, because it sounds like it's a book that would add to our knowledge, and that's always what we're trying to do here. Dr. Van Camp, it's been a pleasure having you on the show. Thank you so much. We'll look forward to having you back.
Thank you. Pleasure's mine.
All right, sir. All right, we have another interesting guest coming up, and want everyone to stay tuned and participate. This guy, now I want to tell you before he gets on there, he's a doctor. He's a doctor of wordology. I've read much of what he's written. It doesn't make any damn sense at all. He can argue both sides and make no difference either way. So the subject is tax the rich. It offers a good kick in the gridlock. I don't know where he stands, or where he sits, or even where he squats. But it's going to be an interesting discussion, so make sure your brain's engaged so that we can be sure we put our mouths into the correct dealer. Stay tuned. We'll be right back.
Hi there, Phil.
Want to talk? So let's talk.
Good. Okay, you need to bring the thing down a little bit.
You want to talk?
Point it
You
down.
gotta talk. You need to talk. News talk.
I talk, you talk to Solomon. I talk,
Yeah,
you
let's,
talk
just
to
even
Solomon.
touch more, just a little bit more.
Let's talk to Solomon.
There you go, that's good. That'll work.
Talk to Solomon.
Good deal. I'm going to hit you up and Stan will bring you on in just a couple minutes.
So let's talk.
Thanks.
Do you have a cell phone? I do. In fact, everyone I know does. There's only one problem with cell phones. They're too damn high. You remember that guy. With me is Ted Williams, one of America's experts on cell phones, and a guy who's been responsible, along with his company, for hundreds of thousands of people saving money on cell phones. Ted, thank you for joining us. Talk to us.
Well, I tell you, Stan, right now, every dollar a person can save is a dollar earned. I'm telling you, in this economy, the price of gas and the unsure situation with employment, our business is tailor-made, and our cell phone packages are tailor-made to help everyone out.
All right, let's state a few facts. Unlimited service isn't unlimited service anymore, right or wrong?
It's right for a lot of the big carriers that you're familiar with, but our company is got truly unlimited talk, text, and web. We don't slow speeds down. We don't charge you after 1 or 2 gigabytes. It's truly unlimited, running on a nationwide network with roaming options if people want it.
And to get unlimited service, which many people use today in their business, you're going to spend $120, $130, $140. How do you compare?
We've got plans that start at $20 with rollover minutes, and our truly unlimited talk, text, and web plan is $59 a month. Again, no limits on the data, and the exciting thing is you can earn, as a customer, you can earn free service by simply referring a few customers to us. That earns you free service potentially for the rest of your life.
Now, let me make sure I'm hearing this correctly. Without paying money, without being in the business, simply, if you're a customer, at whatever the customer costs are, and I assume there are no deposits or that type of thing, that if you refer a few friends and they get service, you can earn free service for yourself?
Absolutely. It's, as you said, no contract, no deposit, no credit check, and we have many payment options. They can be auto-billed, auto-debited, phone in and make your payment over the phone, or, you know, a lot of options on how to pay the bill. But truly unlimited talk, text, and web available to you for $59 a month, and if you refer a few friends, totally free.
Now, 2 other questions. You said roaming is an option. How much does it cost?
If you have unlimited nationwide roaming, it would be an additional $20. If you
you're still only $79.
Correct, but you may not need it because we are on the nationwide network.
Okay, and the second thing is, do you only have dial-up phones that you have to carry in a suitcase, or do you actually have the latest and greatest Droid phones?
We have Android phones are the hottest selling items right now on our site, but we also cater to those people that all they have a need for is a simple flip phone. So you can go from, you know, from the top of the line phone to a free phone.
And are you competitive on those prices?
Absolutely. The phones, most people don't realize this, but the phone prices you hear on television are tied into contracts. We don't have a contract. So our phone, you buy it, you own it, and you pay the real price. The way you can find out how competitive it is simply ask any of those big 3 or 4 companies, what is the price of the phone if I don't have to sign a contract? And they'll tell you many of those Android phones are $400.
There you go. All right, folks, you can get more information by dialing 1-800-299-8362, or just go to cpnlive.com and click on the icon that says Get Free Phone Service. Free. Free. I can afford free. Can you?
Free is good.
Thanks.